We are live. Good morning, everybody. It's Friday the 13th. Hopefully, it'll be full of luck and not bad luck. It's the classic Friday, and I think we're all in the middle of summer holiday. So, thank you for those of us who.
Sorry, I couldn't quite hear.
Sorry, my phone
Could
is.
you please repeat what you said?
No, I don't know what Siri is saying. Sorry. And yeah, so we're going to be starting. We're going to give a couple of minutes because it's only 9:58, so we want to give it till 10 a.m. and hopefully people are joining us. So I will do full introductions once it's 10 a.m. But you've met me before. I'm Toral, and I'm a nutritional scientist and functional medicine practitioner. I'll introduce my amazing guest in a second, and we were going to talk about South Asians and lifestyle and diet specific advice of how you can help to manage not only manage type 2 diabetes, but also to help put it in remission, because I think reversing is really quite strong. It's not something that we can reverse, but it's definitely something that we can help put into remission. So we'll give it a minute or two, and then I'm going to introduce our lovely guest, Natasha. And we're going to talk about a program called Adapt, which Natasha and I invented, which I've just realized now it's 17 years. Isn't that frightening? It's crazy. So yeah, life in the world is going very, very fast. I'm actually in Wales, so I want to apologise if my reception is a little bit patchy. I am working on Wi-Fi, but I am in the middle of Brecon Beacons, so it's a different background today, as you can see. But I will try and stay, and if not, you have the amazing Natasha, who I'm going to introduce in a minute, who is going to share a little bit more. So it's 9:59. Let's give it another couple of seconds before I introduce you and we start our event. And I just want to say a huge thank you to everybody who's worked on South Asian Heritage Month. I know that Jasvir, Ruby, Benita, all the others have worked so hard. They're doing this on a voluntary basis, so please feel free to donate to that. But they've created some amazing events all about health, arts, culture, the environment, religion, politics. It's been absolutely fantastic. And you can watch all of the talks back on the YouTube channel where they're all saved. So feel free to watch and share with absolutely everybody. It is now 10 a.m. So I'm going to introduce our lovely. So today we have with us Dr. Natasha Patel. Are you doctor? Would we say Miss or Mrs.? I don't know, because you're a consultant, aren't you?
Doctor.
Would they call you doctor? So Natasha is a diabetes endocrinologist. I'm going to let her introduce herself. But Natasha and I have worked together for at least 17 years. We've been childhood friends as well, and our parents are friends. So I'm going to let Natasha tell you a little bit more about herself, and then we're going to get into it. So Natasha, over to you. Thank you so much for giving up Friday morning to join us at South Asian Heritage Month.
My pleasure. So my name is Dr. Natasha H. Patel. I'm a diabetes consultant at Guy's and St Thomas's in London. And I've been a consultant now, and I can't believe I can say this now, like 12, 13 years since 2008. Time is going fast. And I really don't feel that old. And diabetes wasn't actually my first choice of a career specialist. I went into diabetes and endocrinology mainly because of endocrinology. But then it became more obvious to me that in our community, diabetes was actually the main focus, and we weren't getting it right. And there was so much more that we could do and needed to do to reduce people coming into hospital to see me. So I do a lot of stuff or things outside of what I do at work, with the aim that success for me is when I become unemployed. So I don't want to see people in my clinic, because I run the complications clinic. You would normally see me in hospital if you have lots of complications. And that's why I was so passionate about setting up this program with Toral, is to see what can we do to reduce individuals coming into hospital with the complications of diabetes. And I just also like to pick up something that Toral mentioned. You hear a lot in social media about reversing diabetes. I agree with Toral. It's more about putting diabetes in remission, because if you go back to your lifestyle before, you'll develop diabetes again. And we'll go over that in a bit more in a little while. So that's a little bit about me. Oh, I just also say, along with that, I've also trained now in functional medicine. So I'm able to bring the more holistic approach to diabetes as well. I'm really keen to bring functional medicine into how we treat individuals with diabetes.
And just a little note about functional medicine, because both Natasha and I are trained functional medicine practitioners and have been for a while, and we've been practicing in it well. It's really looking at the root cause of disease and treating that root cause rather than the symptoms, which does mean that you're more likely to stay in remission if we're treating the root cause rather than the symptoms. And the complications are actually essentially symptoms. So this is why a whole full holistic lifestyle approach, including diet, including sleep, including some of the other things we're going to talk about, is really important. Now, Natasha and I have got tons of slides, but what we've decided to do today is actually keep it more casual and really just chat to you about different topics that we think are really important. Now, if you are on YouTube today, you can go underneath, go to the comment section and ask questions. And we really want to be answering as many questions as possible. So feel free to add all those questions in. Natasha and I will see them, and we will try, once we've kind of completed the formal part of the conversation that we've planned, then we will add to the questions, because that's really important for us. Because what we've got to remember is that we're all individuals, and what is right for each of us is going to be different for others. Even if we're from the same cultural, ethnic background and have a similar lifestyle, it's still going to be individual to us, because there's different elements of our lifestyle which are individual just to us. And like our stress levels might be different, our sleep will be different, all of these things. So, Natasha, where would you say diabetes is, and how can we, why do you think personalized care is particularly important for South Asians?
So diabetes technically means, so we've got to be clear, diabetes mellitus, because there is another condition called diabetes insipidus, and it's very important that there's a very clear distinction between them. And the word diabetes I think it comes from Greek, and it's mainly about passing a lot of urine, feeling very thirsty, passing a lot of urine, which is what you also have in diabetes insipidus. So diabetes mellitus is where your blood sugars are very high, and that's what's causing you to pass a lot of urine or feel very thirsty. Now, what we need to look into is, why are those blood sugars high? And in South Asians, it's so clear that it's related to insulin resistance. We develop insulin resistance from a younger age. And that's a root cause for many conditions that we see in the South Asian community. And again, that's why I believe it's important to take this approach. Conventional medicine normally says that we treat the high blood sugars. What you and I've talked about a lot of is, how do we treat the underlying cause of diabetes, which is the insulin resistance, so that we can have a bigger impact.
And for those who don't know what insulin resistance is, do you want to explain a little bit more about that?
Yeah. So in our bodies, just underneath your chest bone and near your stomach behind it, you have an organ called the pancreas. And it has two functions. One, it produces insulin, which is related to controlling our blood sugars. So we produce that after we've eaten, and it tells our body, you've got glucose on board, take it into your cells and convert it into energy, or store it as fat if you're not using it. The other part is separate to this conversation, and that's more to do with digestion. So your pancreas produces insulin to help us use the actual glucose that we produce from the food that we've ingested. And insulin resistance is when the muscles have become very resistant to that insulin. So you need more and more insulin to overcome that resistance in order to tell your cells, take up that glucose, start using that insulin. So it's a little bit like having a brick wall there, and you're throwing things at it. But that ball is actually it's made out of concrete, and you need to throw a lot of balls at it to knock that wall over. And so that's a little bit like what insulin resistance is. You need to throw a lot of insulin to overcome it, to get those cells to do what they need to do, which is take the glucose into the cells. And for us in South Asians, insulin resistance there's a genetic element to this. An element we call thrifty gene, and there's also a phenotype as to how our bodies have evolved over time as well. That both of those factors make us more prone to developing insulin resistance. And in fact, research has shown that insulin resistance really starts from our adolescent years, and so it's how we look after ourselves after that. Yeah.
So really, it's a whole I don't know if there's some background noise. A whole family approach, because really, if we know that from children and adolescents, insulin resistance can kind of appear, this is where we start all educating not just the people with diabetes, but really the families. And that's where we kind of came up with our program. And before we kind of go into more aspects of it, Natasha and I created this program, as Natasha shared, because we just were tired of seeing people who were really suffering with diabetes and from all the complications. And so we wanted to create a program that helped people. And what we realized is that many of the people in our community, the South Asian community, who have diabetes may not be the people doing the shopping, the cooking, the planning of the meals. So with the ADAPT program that we've created, we invited the person with the diabetes, but also a family member who did the cooking, shopping, and eating. And obviously, if they were the same person, we invited them to bring another person from their family, so that we had two pairs of ears listening and being drawn into this conversation about why nutrition and lifestyle is really, really important for diabetes. And what we can understand from kind of sharing what, following on from what Natasha shared, is that our diet's so important, so that we can reduce the amount of insulin that's being produced from the food, or at least have, when you eat, the insulin kind of increase kind of goes up, and then it kind of comes down after your meal. And what we want to do is, rather than having those sharp increases and sharp falls, we want to keep it a little bit more even. Is that anything you want to add to that, Natasha, before I go into more?
No, I would absolutely completely agree with that. But in order to do that, though, the bit to be clear is that we need to support the insulin resistance and reduce that resistance, so that your pancreas is able to produce that constant amount of insulin, rather than you shooting up and coming down. So again, it's coming back to that underlying cause of the insulin resistance, and how do we support that?
Yeah, and so one of the things that we've kind of looked at really importantly is the diet. So with the diet that kind of Natasha are really going to look at, again, it's so individual. Depends on your dietary requirements, your lifestyle, what else you're up to, your stress levels, sleep. All of those things make a difference, and we will be touching on all of those things. But from a diet perspective, our South Asian diet is naturally quite carbohydrate heavy. So what we've tried to do is use our South Asian diet with our traditional food and all of those things, but really go for a higher protein, lower GI, which was which Natasha will explain in a minute, and more fiber. And that means insulin is produced a little bit more slow. Do you want to add a little bit more about the GI index?
Yeah, so GI is an abbreviation for glycemic index, and hopefully most of you may remember this. It was a big phrase. Diet industry goes in different waves. And I think about a decade ago was when you would see a lot about GI out there. And it's really the index as to how quickly food is broken down into glucose. And so what you really want to be eating, and what we advocate, is food that breaks down into glucose slower, so that has less pressure on your pancreas to produce the insulin. So things like and Toral will do this into a bit more detail. So things like, if you're going to eat rice, brown rice, wild rice, actually, you break that down into glucose a lot slower than you would do with processed white rice. And that's the kind of things that we're talking about, so that your pancreas isn't putting under too much pressure to produce too much insulin. It can do this slowly and steadily. And I think, just to expand on that, the reason why this is so important, your pancreas is going to produce only a certain amount of insulin. And if we can support the pancreas to continue producing the insulin longer, you're less likely to require medication and insulin in the future. Because where that all comes in is that your pancreas is unable to produce enough insulin to compensate for the insulin resistance. That's when then people start getting into trouble, blood sugars go up, they feel unwell, we need to start medication and then insulin.
And I think going back to the whole glycemic index in food, so fiber can really help to slow down the release of insulin and break the breakdown to glucose. So when a food is high in fiber, so that might be which are high in fiber, and all fruits and vegetables are high in different amounts of soluble and insoluble fiber, and we really go into that into the ADAPT program. And then eating higher protein foods, that also takes more time. It also takes more energy to break down higher protein food as well. So you're burning up kind of more just trying to break this food down. And eating foods that are less processed can help with this insulin response, and to kind of make a difference to how we eat. So I think that's one thing. And what we also have done is that the cooking methods of how we eat. Like deep frying food, and I know a lot of lovely, delicious Indian food is deep fried, and when you add like sugar and gore and all these different things, we need to not really be doing that. We need to investigate different ways of cooking, using less oil, maybe using slightly different type of oil, like olive oil. We need to be thinking about, I mean, air fryers. I was watching something last night, and air fryer might be a really good option of how we could cook things potentially. Do we roast things? And how do we add in a lot more vegetables into our diet? So that's something that we talk about. And our in South Indian diets full of amazing high fiber foods, all the dals and lentils and beans that we eat, which is amazing. You can change when you're making chapati or naan or whatever you're making, try and use a kind of a brown based flour rather than a white based flour. And this might, will also increase the fiber, which will slow down this kind of glucose breakdown. So there's all these different elements which are so important. We haven't really talked about portion control because Fahriha kind of covered that last week. So, well, we will talk about that. But again, it's about increasing the amount of protein-rich foods, increasing the amount of fiber-rich foods, and reducing those processed carbohydrates like the white rice, the white flour, all of those things. And then it's not about cutting things out of your diet. Natasha and I just don't believe in cutting things out of your diet. What we really believe in is adding things into it. And if you're adding in more fruit and vegetables, you're adding in more fiber, adding in more protein, adding in all these things, fermented foods like chash and all that kind of buttermilk and yogurt and stuff like that, this is going to be much better for you. So that's something that's we really like to work with our own diets, because we know that we don't want to be eating other types of food. We want to be eating our traditional food, but how can we adapt it to make it kind of suitable for people with diabetes? I've noticed that Natasha's just muted herself up because there's a bit of background noise, so thank you for that. So I wanted to talk a little bit more about the gut microbiome. It's been a really hot topic over the last 10 years, and I know everyone's really interested in it, but I'm not sure how many of you know the link with diabetes. But what we know from our food perspective is that our gut, which is our colon and the end of our digestive tract, is full of beneficial bacteria, and this is called the gut microbiome. And actually, these bacteria are really, really important because they fulfill lots of functions that our own bodies can't fulfill. So, for example, they can make certain vitamins like vitamin K. They can break down fiber, and particularly sort of more insoluble fiber. And then they can also affect kind of your mood, because there's a gut-brain axis, which can make you feel kind of, if you're eating more processed food, it may affect the way you're feeling. There's so many other kind of functions that the gut microbiome fulfills. But what we've started to understand in the last kind of 10 years is how important the gut microbiome is for both detoxification, that is binding the elements that are broken down, particularly for women. Like we bind estrogen and we have to get rid of it once we've used it. And all sorts of other hormones, and also for hormone production. So, Natasha, do you want to add anything about the link between the gut microbiome and hormones? Because I know that's something you're very passionate about.
Yeah, so it's really actually interesting. 15 years ago, when we started this, I don't think we fully appreciated the whole link with the gut microbiome. The research has become so...
So, Natasha, it's quite hard to hear you. Can you maybe increase your volume? And no. Let's see. Sorry, everyone. It's like technical hitch. If I mute myself, let's see if that works. Go on. Go for it. I can hardly hear you. No. It's very, very quiet. Now I can hear you. Now we can hear you. Go for it.
You can hear me now?
Yes.
Perfect. Okay. So I guess what I was saying was that when we started our program, we weren't aware how important the gut was. But over the last decade, it's become clearer that the gut is important on so many levels, not just for diabetes, but for so many conditions. And it's about, if we think about it, it's the first port of entry how a lot of things come into our bodies. And it's about how effectively and efficiently it's working. And if the gut is unhappy, then actually that has a knock-on effect on lots of other organs in our body as to how they're working. So especially for diabetes, if you think about it, if your gut's unhappy, then you're putting more stress on your body. you put more stress on your body, that results in more insulin resistance. And that's why you and I have become more and more fascinated about the impact of the microbiome on diabetes. And then there's a lot more to talk about this as well, and specifically more things that we can do about improving our guts and how well they is.
So one of the things I really kind of help people to do, and we kind of have taken into the ADAPT program, is to look at how we can improve our gut health. And that includes our gut microbiome and kind of supporting those beneficial bacteria. Part of those actually lifestyle elements, and we'll be touching on this later, but things like sleep, reducing your stress, exercise can all help the gut microbiome. So you can see why using this kind of holistic approach where everything's involved is really, really important. And I think that's the element that we have to really, really remember. That so there's so much thing, but from a nutrition perspective, how do we support our gut microbiome? We know that eating at least 30 plant-based foods a week, so that can be fruits, vegetables, nuts, seeds, legumes, can support your gut microbiome. Eating fermented foods like yogurt, dairy, some of our pickles, atar, all those things can make a difference. Reducing kind of processed food, that can make a difference. Thinking about the stress levels in our lives, all of that can make a difference. So it's a really kind of a holistic all-round approach. And our gut microbiome, we're learning so much about it. We've got some amazing research happening in Australia where they're showing that if you eat a more Mediterranean style diet, so that is a diet that's really high in fruits and vegetables, legumes, nuts and seeds, with small amounts of fish and dairy, even less meat, that is really protective of the gut microbiome, but also that can help support with anxiety and depression too. So I think there's a full circle approach to this, not just diabetes, but helping you your whole health process. So that's kind of really, really important for us to really think about. And I think the gut microbiome, as Natasha shared, we're getting more fascinated by it. And we want to kind of translate this into the foods that we can eat as South Asians. So on that note, I was doing lots of research on the South Asian diet. I noticed there's no healthy South Asian plate. So I've actually created one. We're not going to show that today because it still needs a little bit of editing, but we have created a South Asian healthy plate, which shows all the different kinds of foods that we could be eating. And this means all different kinds of food. So as Natasha said, changing from brown and wild rice rather than white rice, changing the flour, but then eating different grains like millet. Millet's such a thing that we've eaten, particularly in Gujarati community and other communities, like changing things like making biryani with pearl barley or something like that, or making khichdi with a mixture of quinoa and rice, just to increase the protein and the different types of amino acids and nutrients available. So there's all of those different things. And I think also if we can add in more vegetables, so I think we're always focused on eating more of the rice or the chapati or the millet, flatbread or whatever it might be, the rotlo, all of those foods. Rather than that, let's try and focus on adding in those vegetables, adding in those protein-rich sources. So that's, kind of something else. So I'm going to move on because we haven't got much time. It's already 20 past 10. And I want to talk a little bit about exercise and diabetes. Both of us are really passionate about exercising, both Natasha and I, and what exercise to do. So Natasha, do you want to sort of just say a little bit more about your take on it, and I'll add in a little bit more?
Yeah, so I think it's really important to differentiate between different types of exercise. Please tell me you can hear me.
I can hear you, sorry. I'm listening very intently.
So it's really important to understand that there are different types of exercises and they have different purposes. Just saying that you go running, for example, several times a week is not sufficient. So running is really great for cardiovascular, that's really great for your cardiac health. And then where I get really also interested is that I'm not sure how many people are aware is that once we hit to 30, we start to lose, if we're not conditioning our muscles, naturally we would lose a pound of muscle a year. And that's really important for our metabolic rate and how fast we burn energy, which is why most of us who are over 40 now, if we try to eat the same things that we ate when we were 20, we would actually gain weight because our bodies just don't work efficiently. So coming back to the exercise, it's really important then for me for resistance training. And that's what I'm leading up to, because resistance training is so important to our muscles and our muscles' health, and to tackle actually insulin resistance, which is the underlying component of
Yeah.
diabetes. And the bit that I always try to explain to my patients, strength training does not mean going to the gym and having to do weights. There are so many other things that you can do. Pilates, yoga. Yoga is such a great one. And there things like Qigong is also another one. But the main one that we're quite passionate about is yoga, because that's got really good research data behind it as to how it helps with our muscle and then insulin resistance.
And actually, from the yoga perspective, we've got quite a lot of evidence with the link to how the actual yoga process can affect your insulin resistance. And that's really important. And just kind of following on from Natasha and the resistance training. So that's one thing I talk about quite a lot in our generally to all my patients, but also particularly in the diabetes patients and even with our cancer patients, because when you can increase your muscle mass, it almost provides a little bit of a buffer for the insulin. And the more muscle you have, the more you can, it helps to buffer the insulin resistance, which means that it doesn't reduce it, because I think but it helps to kind of create an extra pot, so you don't have to be throwing all those stones, as Natasha kind of shared. So what we talk about exercise, there's 4 different types of exercise that we all need to be doing for our overall health. So one is the cardiovascular aspect, which Natasha shared, which is for your heart and increasing your fitness and your stamina. The second is resistance training, strength training. So as Natasha shared, you can do yoga, you can do Pilates, you can do strength, you can do weights. But also people like Dr. Rangan Chatterjee have created loads of exercise that you can do at home, just with a chair or with cans of beans and things like that. And I think Lavina Mehta, who did another event about diabetes for South Asian Heritage Month, she showed lots of exercise of people could do at home with different things like bottles of water or just with a chair. And I think we have to remember, it's not about going to the gym. It's about using those muscles and making sure that we keep what we have. And obviously in an ideal world, we'll build that too. And then the other thing is, we want to talk about the difference between, we've got mobility as well. If we can keep ourselves, our joints mobile and be flexible, then that will also help us to keep exercising. So that's another important part of exercise. The thing I really want to talk about was the difference between a sedentary, sitting down kind of lifestyle versus kind of NEAT. NEAT is basically called non-exercise thermogenesis. Now, when we're thinking about fat loss or weight loss, which is something that's very commonly discussed within the diabetes realm, we are always talking about exercise and diet. Now, what has happened in modern life is that we've become quite sedentary. So right now, unfortunately, I am sitting down. I'm assuming Natasha's sitting down too. I don't know. Normally, when I do these talks, I have a standing desk at home. But what we've realised from a lot of the more sedentary, the more we're sitting down. That might be sitting down at your desk when you're working. It might be sitting down watching TV. It might be sitting down in the car when you're driving. All of those things means you have a more sedentary lifestyle. And what we really, really encourage people to do is to really kind of make a note of when they're sitting and when they could get up and have some movement. So, for example, a lot of us are still working from home. Can you take a meeting on the phone while you're having a bit of a walk, whether you're using headphones or the headset? That would be one way of increasing your non-exercise movement. So you're not doing this for exercise, you're just doing this for movement. Could you get off the bus stop one stop earlier when you're going somewhere? Could you park your car at the far end of the car park if you go to the supermarket? All of those things mean that you're moving more. And I think if we have one of these tracker devices that I wear, Oura Ring, I know lots of people have Apple kind of watches and Fitbits and things like that, that basically tells you if you've been sedentary for too long, which is a great reminder. But what I try to do is that even when I'm working and I'm writing articles and I'm really engrossed, is to get up every kind of half an hour and just stretch, move around, do some movement. And I know Lavina Mehta has talked about this too. Exercise snacking, she calls it. And I think that's something to add in. And obviously what she's talking about is actually adding in more exercise. What we're talking about is just stop sitting, basically. Try and move as much as possible. And this is actually more important. And when it comes to fat loss or weight loss, the thing that's going to really make the difference is A, your diet, but B, it's this NEAT, which is this non-exercise activity. So it's when you're moving around. So for example, this week, I've been on a retreat cooking and doing meditation. So whilst I have been sitting a lot doing meditation, I'm actually cooking a lot. And so that means the amount of steps I'm walking around is actually been quite a lot. 'Cause 3 meals for 10 people every day is quite a lot, especially I'm making sure I just go and add in some extra kind of walks. So I don't get everything I need from the fridge or the pantry at the same time. I kind of was doing a few extra kind of trips. A, because I couldn't carry it all, but B, just to give myself those extra steps. So really, monitoring the amount of your steps is a really good way to start with exercise and trying to get a bit more mobile. And the more you exercise, the more your body will respond to insulin. Do you want to add anything about that, Natasha? So we can't hear you. You're mute. You're on mute.
Just to say that I agree with you, especially about the mobility, that it's also becoming clearer how important moving is for us, and especially again regards to diabetes. And it's the consistency behind it as well. So, you know, every hour, just making sure that you are doing it rather than just having hits become really popular, hasn't it? Which is that high intensity, which is great from a cardiovascular point of view, but that doesn't then mean then for the rest of the day you can sit around. And it's to remember that mobility, movement, is just as important as fitting in your exercise sessions. And again, all of this has got clear data linked with diabetes management and insulin resistance.
Thank you. So I'm just going to now touch on sleep for a little bit, and I'm going to bring it back to you. But one of the things that's really important is sleep. And we don't always think of sleep as being important to diabetes management, but sleep is really important for all aspects of our health for many, many, many reasons. But when we're sleeping, our brain is cleared out, and it's, we process a lot of our thoughts, our memories. But when we're sleeping, we have different levels of hormones. If we haven't slept well, we have different levels of leptin and ghrelin, which are hunger hormones. If we haven't slept well, there's loads of evidence to show that you are going to be more hungry the next day if you have a poor quality sleep, you haven't had enough deep sleep, you haven't had enough hours of sleep, and you will also crave more sugary, fatty foods. So sleep is not just important for our hunger and what we need to eat, but there's also a whole massive link with diabetes and hormones. Natasha, do you want to share a little bit more about that?
Yeah, so sleep is important in so many regards. So if we go and look at the underlying cause of diabetes again, insulin resistance. If you haven't slept enough, there's clear data that your body wakes up with increased stress. So your stress hormones go up. Increase in stress increases your insulin resistance levels. You're more likely with insufficient sleep to wake up with higher blood sugars in the morning as well. And then, as Toral also explained, if you've had the right amount of sleep and your body is rested enough, you're more likely to make the right choices during the day for what your body actually needs. You're not treating the tiredness that you would feel from not having slept enough. And I have to say that this, for me personally, has been such a big change, because being a doctor, part of doctor training is that you're taught how to have very little sleep. And I have to say, I never really appreciated the importance of sleep until all this research. We've been flooded with importance of research of sleep in the last 6-7 years. I mean, it's just becoming clearer and clearer the impact of good. And it's not just about the duration of sleep, it's the quality of sleep. So it's making sure little things, that your room is blackened out, that you don't have your laptop in your room. So I personally historically used to sleep with my laptop. I was always working, laptop, phones, everything away, to make sure that as well that your quality of sleep is important. Again, this is one of the things that Toral and I talk about in a lot more detail during the program, because it is so important with the management of diabetes.
And I think going back to the sleep hygiene aspect of it, we have really clear guidelines of how, as Natasha said, keeping your room dark, but also things like not eating too late by bedtime, because your hormone levels go. Also, your temperature, our core temperature needs to fall, and it needs to fall to about kind of 19 degrees. And if we've just eating actually releases heat within our body. So it's really important for us not to eat. I would suggest not to eat 3 hours before bedtime at least. Also, not having any devices in the room. So, for example, I've now started plugging my phone in outside my room and have an alarm clock. But also things like having a warm shower before bed can help to reduce this temperature. If it's really hot in your room, and I know we've had a very erratic summer this year where it's been really hot and quite cold, really hot, but like having a fan or having, windows open or whatever it is to kind of keep your room cool, dark, and relatively dry. And obviously, if you have a house that's very, very dry, you might want to put some water so it's actually slightly moist, so you don't wake up with a really dry throat. So there's so many different aspects of sleep for us to manage and think about, and all of this can affect a health in many ways. It can affect your choices, so not just what you eat, but kind of how tired you feel will make you feel. Think about how motivated you are to exercise or to cook food or to buy the right things when you're out, shopping. So all of these things make a difference. So I think Natasha touched on stress and the impact of hormones. So one of the things we've talked about in the ADAPT program is managing stress. We've touched on it before, but stress can impact your hunger. A lot of us stress eat. I'm definitely one of those people. But it can affect our gut microbiome. It doesn't work as effectively. It can then become out of balance. And that's really important. Stress can affect our mind in so many ways. So doing yoga and meditation, all these things can help. But I'm going to go over to Natasha, who's got a lot more to share about stress and the impact of hormones.
So there's a lot to talk about this, but the headline is really stress increases insulin resistance. Increased insulin resistance results in diabetes and high blood sugars. Now, remember, it's a component of it, but it's also an important component that if we would like to manage your diabetes and to put your diabetes into remission, that we need to manage. And there are so many tips that we have developed and evolved, and everything we talk about in the course are things that we actively do ourselves. So we do this. So one of the things that I talk about a lot in the course is developing your own morning routine. And I'm really passionate about this because I also say this with diabetes management. If you start the day off good, then the rest of the day just automatically flows. And that's the same for managing your diabetes. But if you started your day off in a good place with your blood sugars, it becomes easier to manage it during the rest of the day. But if you're starting the day stressed, worked up, high blood sugars all in the morning, you're playing catch up during the rest of the day. And that's why we come back to the morning routine. And one of the things we talk about is how to develop a morning routine that works for you as an individual. There is no one set morning routine that works for everybody else. And then your evening routine. Part of these routines, and the reason for the evening routine is to help wind you down, ready to have a really good quality sleep. Now, part of these routines include looking at meditation, which is what we're alluding to. And one of the things I like to talk about is, or to explain, that there's a very clear difference between meditation, mindfulness, and being mindful. So meditation for me is really what we also know as, I think Toral abbreviated it the other day for me as TM, transcendental meditation, where really that is, you put, and then there's very clear research, and as part of the ADAPT, I'll show you the videos that demonstrate the effect that transcendental meditation has on your brain activity, which is your whole brain just literally slows down. And then you have mindfulness, which is where you're focusing and you're going on a little journey. And that focuses on just one part of your brain. And then there's being mindful. And being mindful is more about how you're acting during the day and observing and seeing what you're doing. And all of these things, I know this may not come across normally as being the things to talk about when managing diabetes. But the reason why we're very clear about it is all three of these different processes have a different role to play in bringing down your stress levels. And bringing down your stress levels then from a biochemical point of view then impacts your insulin resistance. And that will then affect your diabetes management and help support you in aiming for remission from your diabetes.
And continuing on from that conversation, so with the stress, when you are more stressed, you have increased levels of cortisol, and we know that can increase inflammation, which can increase the risk of other diseases. So it all fits together, and we taking this holistic approach where you're focusing on your diabetes maybe, but actually impact the rest of your health, your mental health, your physical health, with reducing the risk of cardiovascular disease, which is massive in South Asian, cancer, which is increasing sadly, and kind of a stroke and other kinds of disease. So other kinds of lifestyle kind of aging diseases. So we want to remember that all of these things can impact our risk of disease, full stop, and and make us happy and healthy people. And for me, my motto is people are happy and healthy. So, and Natasha has a similar motto, and we really just want people to be happy and healthy. And in an ideal world, yeah, we would both be out of a job because everyone would know how to look after their health by eating the right things, sleeping well, and we would be able to go and just sit on a beach and relax. So that's kind of the kind of end goal with that. And I'm conscious of time, so I want to answer some questions a bit, but I want to just talk a little bit more. Being a woman who is in her 40s now and has had cancer, I know that there's lots of questions around female hormones and diabetes, and we just want to touch on this because traditionally diabetes is seen as a kind of male disease, but there you have your beer belly, well, not your beer, but whatever your belly is, it's sticking out, but actually it's quite slightly different from women. So Natasha, do you want to share a little bit more about the touch of female hormones before we add kind of go
so just to touch on it very clearly, so if we take the female stages of life, so we take the menstruation stage, just the normal cycle of how our estrogen and progesterone are affects insulin levels, insulin resistance, and affects our blood sugars. And that's important, very important, I feel, for type 1 diabetes, as well as the type 2 diabetes and how you manage that. And then it becomes, I think, even for type 2, I think it becomes even more prevalent or more obvious during the perimenopausal phase and the menopausal phase, but especially during the perimenopausal phase, about how it actually affects glycemic control. And it is related to our estrogen, progesterone. The research is all there. And what we then talk about during the course is the things that you need to adapt that help you manage that. So it's understanding that in more detail. And then for you to work out because what happens for each female is slightly different for everybody. It's not the same for everybody. I've yet to meet anybody who has recited to me the exact same symptoms that they're having as somebody else when it comes to the perimenopause. And that's why it's very important to work out a plan based just on you and what your hormones are doing and how they're doing it. And it's also really important to remember that the perimenopause stage is not very well picked up.
Yeah.
And it can happen, way before you see anything on your blood tests. And it's about, again, us being mindful about how are our bodies being, how are they behaving. And then, Toral, from your situation, because, again, whenever the female hormones are affected, again, that does have a knock-on effect on insulin resistance. There is clear links, the clear associations. So, yeah, there are things that we can do to help compensate, to deal with it. It's just being aware of those, being aware of it in the first place.
And one of the things we're starting to understand and learn about is really also the link between our female hormones and our gut microbiome. And there's something called the estrobolome, which processes the estrogen, progesterone from our body. And obviously it's really important in perimenopause and menopause. And we can actually change this by what we eat and how we eat. So I think that's really important. And again, with exercise and adding more muscle, that can also buffer things in a slightly different way. When we think about the gut microbiome, we're all individuals. So some foods may spike a massive insulin response in one person and not in others. And Tim Spector does some fantastic work in this. And some people can just eat pasta and that's fine. And some people will not be able to eat even like a little bit of pasta and their insulin response will kind of go. So I think it's to remember how individual are, and even as identical twins. And I'm fascinated by twins, by the way, and my best friends are twins, is that they will have a different response because as much as they're born at the same time and they're genetically even, maybe, are the same, they're, after the birth process, their life could be slightly different because they come into contact with different people, different foods, different environment. So this can all impact your gut microbiome. There's so much that Natasha and I could talk about. What we want to do is answer the questions now. So if you have any questions, pop them in the YouTube, underneath the YouTube, and we'll have a look at them. I'm going to pick one up now. Rohini, who I know runs a cancer support group. What effect does cancer have on diabetes? And I mean, I've got some thoughts I want to share, Natasha share, but I know that if we have type 2 diabetes, you're twice as likely to develop liver or pancreatic cancer, and you could potentially have a higher than normal risk of developing colon, bladder, and breast cancer. Diabetic women with breast cancer have a higher mortality rate than women with breast cancer alone. and this is from kind of coming from the National Cancer Institute. I want to. What are your thoughts,
Yes,
Natasha?
I agree with that. And then there's also the other aspect, looking at it from the other way, that having cancer and what does that do to diabetes. So having cancer is putting your body under stress. So that can make your blood sugars go up, but then also more importantly, it's a treatment for cancer. And that can have a big impact on diabetes, especially if you are given steroids. Then frequently or not, then we need to do aggressive treatment with insulin to compensate with that, because you're often given short bursts of steroids. So there's two ways. There's the aspect that having diabetes can, because of the underlying insulin resistance, can increase your risk of developing certain cancers, as Toral mentioned. But it's also the other way, that having cancer can also affect your blood sugars, and can also, if you already have diabetes, can make it more challenging for you to manage your diabetes. And that's why then again it's really important with what we talk about as to how you can try damage limitation. But even then, we need to be aware that you possibly still need short courses of treatment of insulin to cope with some of the treatment you have for the cancer.
And we have to remember that obesity is a common factor for both, for 13 different types of the most common cancers and diabetes. So that is also another level or layer of how potentially cancer and diabetes are interlinked. It's not a direct link, but they are both. There is still a factor. I don't know if you have anything you want to share again about that.
Yeah. So weight generally, I think is a really interesting one, and I think this is where it also still comes back down to the genotype and the phenotype, because not every obese patient or individual has diabetes. So it still comes back down to the underlying insulin resistance. But without doubt, weight has got clear correlation with insulin resistance. That weight is correlated. So an increase or excess weight is associated with an increased insulin resistance. But for some individuals, it's a lot more than others. And without doubt, there is clear data that if you lose that weight, that can help reduce your insulin resistance. So yes, I think weight is an important one. But it's also been very clear, though, I think, Toral, that especially for South Asians, I think the bit I'd like to be clear about for South Asians, it's at a lower weight than Caucasians because of the underlying because of the underlying insulin resistance, and we get more visceral adiposity. So by that I mean we get more fat around our organs, which is what increases our insulin resistance. And you don't see that. Not everybody gets a beer belly.
And actually, I'm going to refer back to a patient. We'll call her N. And Natasha and I had this patient about, I would say, 2005, 2006. Very, very, very slim. Her BMI was actually only 18.9. And I really went back to our notes for this one. And yeah, when we actually managed to do body fat and measurements and impedance testing, and just to see. And what was really interesting is, despite her being very slim, her body fat was really quite high, and most of that was around her organs. And that was something that we had to help her manage. So it's not necessarily your outward experience or your outward weight. You have to look at your kind of body fat levels, and BMI is a very, very poor measure of this, because we could have more muscle, less muscle, our bones, all of that kind of thing. And so, and I'm in a classic example of that. But what you could do, which is really a good way, is looking at your ratio of waist to hips. So that's kind of the obesity perspective. But just kind of quickly going back to the question of the link between cancer and diabetes, the other thing I wanted to share, and I'm sure Natasha can add to this, is some forms of chemotherapy can induce insulin resistance, bringing on diabetes. And also there's some forms of immunotherapy, which is one of the most amazing advances in cancer treatment, which can bring on type 1 diabetes, because with the immunotherapy, your immune system's kind of unleashed, and it may attack critical insulin producing cells in the pancreas. So there are those elements if we're looking at the link. So that's kind of the effect, essentially, of what cancer can have diabetes. I don't know if you want to add anything to that, Natasha.
No, I would actually agree with that. I think that's what's also really important. And I've also had individuals who, once the cancer treatment is over, then the diabetes has gone back into remission. Again, confirming that a lot of it's due to medication, can be due to the medication, and the consequences of the chemotherapy and the effects, because having chemo and radiotherapy, you're putting your body under a lot of stress. And then again, that also can lead to insulin resistance, leading to your blood sugars going up. But also don't forget the pancreas element of it, that if we're putting a pancreas under stress, or the pancreas gets unhappy, or the pancreas is attacked for whatever reason, or if you've got something like pancreatic cancer, it may be just that your body's unable to produce any insulin at all whatsoever. So that's why when we talk about cancer and diabetes, we have to look at it from both sides. Cancer's effects on diabetes, and diabetes effects on your risk of cancer.
And that having diabetes can be a potential risk factor for some of these cancers and can increase your risk. So we'll remember that essentially diabetes, in the end, a diagnosis of it is almost a symptom of some sort of imbalance within your body. And in this instance, it's showing that your insulin producing cells and the management of it is not working well. So that is the root cause. And there may be other things that are going on. And these other things are because of the obesity aspect and inflammation aspect, may be related and may increase your risk of cancer. And we're doing so much more research on this all the time. And one of the things I'm particularly interested in is the impact of stress on your risk of cancer, particularly if you've got estrogen positive breast cancer. What we realize is like the kind of process of detoxification of removing estrogen from your body may be impaired if you're in a highly stressful situation. And because some of us have immigrated, immigration is a stress. You know, settling into a new country, new culture, all of those things. And it can be inherited trauma, even if it was your grandparents. So we have to remember there's so much to this. And I think it's such a fascinating topic. I'm also conscious of time. So we're coming to the end of our hour. I know we're pretty strict here at South Asian Heritage Month. And I'm just so delighted that we've been able to talk about diabetes in a more holistic way. But it's also, there's other talks. So do go back and watch Faria talking about portion control. Go back and listen to Lavina Mehta, who did a talk about how exercise, snacking, and diabetes. There's so many different aspects of it because it affects South Asia. So can we just quickly touch on the stats a bit more? I know that South Asians are up to at least 6 times more likely to suffer from diabetes. I don't know if you've got any updated stats, Natasha.
I don't have anything more than that, but what I can say to you from the data that I have is that diabetes patient, South Asian people, let me go back. Individuals with South Asian individuals with diabetes are more likely to have cardiovascular disease. You know, the prevalence of retinopathy, so which is when diabetes is affecting the back of your eyes, that's also going up as well. You're also more likely to have a stroke, and we are now developing higher rates of kidney disease as well, resulting onto requiring dialysis. So the complications of diabetes in certain areas is beginning to grow in the South Asian population.
Yeah, and I think it's sad because we have this amazing community who do have these delicious, nutritious meals, and we just have to shift it a bit to kind of work with living a westernized lifestyle as well, and kind of bring it all together and making sure we're having enough time for ourselves, essentially. And I think particularly we're so focused on working, earning money, all of those things. Sometimes we maybe don't necessarily have the capacity or the want to necessarily put ourselves first. And I think that's also something that Natasha and I actually do touch on the ADAPT course. And looking after yourself is so important. I think we're not necessarily taught, particularly as Asian women, to do that. We're taught to look after everybody else. And I know there'll be men watching too, and they'll, it's not the same for everybody, by the way. It's not all men, by the way. But it's just a kind of from a cultural sensitivity perspective. And we have to remember all these things, that all of these things affect our health, both physical, mental, and emotional. So I do want to kind of bring it back to that. So what I'm going to do now is I'm going to just share some slides so you can know how to contact both Natasha and I. So Natasha and I are starting a new ADAPT program. The type of program it is it's a group program. And it has peer and community support. So you start the program together and it lasts 3 months and you support each other. And obviously we're there to support you too, but it's really important to sort of be part of this group because what we found with any behavioral change, and many behavioral change specialists will share this, is when you've got people holding you accountable and supporting you and telling you you're doing a good job, things are much easier. So we really, really believe in this community aspect. And we've always relied on this with the ADAPT program. So I just want to quickly share my my page. Sorry, what do we call it? Share my screen. Let me hold on a second. I have to figure out how. I remember how to do this. So I'll just tell Ruby. Right, give me a second. I just want to show you a couple of slides. There we go. Share screen. Share screen. Sorry, you have to remember. Sometimes the technology it's hard for me. So just a little bit about. You can see Natasha and I, and just kind of what we're doing. It's called the ADAPT program. We're on social media, and we are starting to get a little bit more out there. We've traditionally done this by word of mouth and through all the patients that we already have and through our families, but we're now trying to be a little bit bigger. We've had so many patients in the past, and so many have maintained their kind of diabetes support over the years, and so that's really important to us. And again, we really kind of come back to this day after day. And the World Health Organization definition of health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And when we relate this to diabetes, we really look at your physical, mental, and social health, and which is why the community support aspect is so important for our program, the ADAPT program. And we look at all the lifestyle things. So we look at the diet, nutrition, we look at physical activity, we look at stress reduction and mental health, we look at social health and healthy relationships, we look at sleep, we look at avoiding substances that harm your health and brain. And if you do want to get involved, we are starting a new ADAPT program in October. So you can email us at adaptdiabetes@gmail.com. Natasha has a private practice from September. She's on a holiday for the next few weeks. So if you do want to contact her, go to go.limited@gmail.com. And I see patients for my cancer and specialists and other things too. But really to optimize your health and look at your genetics, because I'm a master practitioner in genomics. That means looking at your genes and how they interact with your environment, your diet and lifestyle. You can email me at info@theurbankitchen. And I'm going to stop sharing and I'm going to do some takeaways. So Natasha, what are your main takeaways? If you want to start looking at your diet and lifestyle differently to help manage your diabetes, what are your most important takeaways?
So be mindful of what you're eating. I don't think there needs to be big changes to our diet. It's about looking at the quality of what we're eating, going for your higher fiber diet, less processed food, and exercise. Keep moving. Keep moving. And yoga is a great thing to add in if you're able to do for so many reasons. And your daily meditation, mindfulness practice are the three kind of things, takeaways I would say from our hour session now. I'd like people to think about and reflect on.
And for me, I'm going to add in eat the rainbow, eat a huge variety of different fruits and vegetables and herbs. Add in your methi, your dana, your coriander, your fenugreek. Add in everything, to mint.
Spices.
Add in herbs and spices to everything. Turmeric. I mean, we haven't touched on that at all today, but I could give a whole 3-hour lecture on turmeric and why it's so important. But we've got to remember one thing: turmeric, healthy, fat soluble. So when you're having it in a traditional sense, we always have it with milk or fat or ghee or oil or whatever. That's great. Your body can use it. When you utilize it, when you put it into something like almond milk, it doesn't work because it's there's not enough fat. Just aside. So yeah, eat the rainbow. The other thing is really making space for quality sleep. So sorting out your bedroom, making sure you have it dark, cool, lovely sheets, make it a really sanctuary, a lovely soft space so you can get some good quality sleep. And then find some movement that you love, because I think that's really important. Not only does it make you feel good from an endorphins perspective, helps reduce stress, but we know it kind of helps with insulin resistance. So I'm conscious of time. Thank you so much for joining us. And thank you so much for South Asian Heritage Month for creating this amazing month of events. They are all saved on the and learn from them and continue to learn, and please share. There's such knowledge and there's so much kind of amazing kind of stuff out there. I've learned so much from this whole month, and there's a few more days left. There's some great events over the weekend, and it does end next Tuesday. So thank you so much for joining us. And for those of you who've joined the whole series of Healthy Chai and Chat, thank you. It's been such a pleasure to be with you all. And next time I'm going to try and do it more in Gujarati and Hindi. Well, and one thing that Natasha and I are doing is we will be translating and doing our talks, doing part of the DAP program in different languages, and that's not ready yet, but it will be. Some scientific words, we don't have them yet, so we need to work those out to explain it, but we think that's going to be really important. But thank you so much. Wishing you a wonderful weekend and a great summer if we don't see you until the autumn. And do follow us on Instagram if you're on there. Natasha's got hers up, which is Dr. Nath, Nath Pat. Mine is at the Urban Kitchen. Adapt is on Adapt Diabetes. Have a wonderful day and take care. Bye-bye. We can leave the studio now.